You're all over the place these days.
Yeah, we are. We're all over the place, all over the state of Montana for sure. And do that when we're here, and we get home every weekend. And so we every weekend but 2 last year I was back in the state of Montana. So visiting with folks about issues that are important to them, and coming up and talking to Big J
and McLovin. Yeah.
McLovin, yeah.
This is a especially busy time, though, I would think.
Yeah, they tell me we serve in interesting times, and sometimes I wish they're a little less interesting. There's huge issues out there, healthcare being one of them, that we're taking all the action out of the room in D.C. right now. It's something that everybody's putting a lot of work into, and trying to get something that works for everybody and something that doesn't break the bank.
What do you think the solution is? I mean, obviously it's more complex than just figure this out for us right now, Senator, but...
Well, I think it ultimately, I think it has to have certain qualities to it. It has to be affordable. Number one, if you can't afford it, it doesn't do you any good. Over the last 9 years, I think insurance costs have gone up almost, I think it's 93% or 83%, something like that. And if it continues to go up like that, nobody's going to be able to afford it. So it's got to be affordable, and there's got to be access. Rural America, you've got to have access to the hospital. And if you got your health insurance, you get to keep it. I want that to be a part of it, and then a good prevention and wellness program that will help people stay healthy, so they don't have to go in the hospital. Those are the things I'm looking for in the bill, and make sure that everybody has access to health care. That's what's going to be critically important. Right now, health care is happening in the emergency room, and that's not the way to be doing it.
A lot of people are making saying, like, why is this necessary? And the argument is, well, obviously because people need health care. Yeah. We need to do that. But some people make the argument, everybody that needs health care gets it now. I mean, if you have no money and you're on the street corner and your leg gets chopped off and you go to the hospital, they'll take care of you.
That's true, and that's a good thing, and that's also part of the problem where everybody else is end up paying for that. That's what's driving health care costs up.
But isn't that going to be the same? I mean, who's going to pay for it in this plan? I mean, if we're not going to keep paying for it, then
that's the devil in the details. Yeah. Hopefully, if we can get everybody insured, it will stop the cost shifting, and it will be more affordable for everybody.
I see. So that's the idea: is take the price down overall, so then it evens out. Okay.
Yeah. And if you keep people healthy, just like you. If you're not healthy, you can't come in here and work and make a living and make money and all that stuff. I'm
in radio. We don't make a living here, Senator Tester.
That's right. I forgot about that. That's right. You scratch by, eke by a living. How's that?
that works. So that makes more sense to me now, because I was always, that's kind of one of the big questions is, like when you were up with Obama in Bozeman there, and he's saying, I want to insure 50 million additional Americans. Like, how are you going to pay for that?
Well, there's going to be some cost savings. There's no doubt about it. We have repetitive procedures, duplicative, whatever you want to call them, procedures. We've got situations where people are getting sick after they just get out of the hospital. We can work on some of that stuff to save some money, and then hopefully, but we'll see. We'll get a bill in the Senate here, hopefully sometime in September, that we can talk about and debate and find out what's good about it and what's bad about it, and then move forward with something that works for everybody.
What do you think about? Are you fine moving forward if the Republicans aren't on your side? Like, it sounds like Baucus is just going to power right through no matter what happens.
Well, I don't know. I'm going to look at the bill from my perspective and a Montana perspective and move forward with something that works. If we can't get something that works, of course, we're going to have to keep working until we do.
Here's one of my questions, too. As a senator, obviously we elect you to represent us. Do you think that, like, what if, say they took a poll of Montanans and 65% of Montanans said no, no, no? Would you side with them, or would you decide that you know better than those 65% of Montanans?
You never know better than the 65% of Montanans. I think what we need to do is, once we get a bill, is do our best. I've got 8 offices in the state of Montana. Do our best to get people to communicate with us once we get a bill, because until that time, people just guess what might be in that bill.
Yeah, that's a good point, too, that people need to know, is that right now people are arguing what ifs.
Yeah, what ifs, that's right. Yeah. And then get something that's solid, look at it, make sure it's affordable. Heck, we don't want to add to the national debt. It's big enough the way it is. We need to work on bringing it down. So. Yeah.
Isn't it unconstitutional to force people to buy health care? Is one of the questions that somebody pitched yesterday.
Maybe, but on the other side of the coin, if you don't have health care and you get sick, what do you do? That's part of the problem. So that's part of the issue.
Yeah.
Somebody get squeaked in?
I think it might be me.
You?
He's just
All right.
standing in the corner squeaking. That's what he's there for.
That's actually my job here.
Where else are you headed today? I mean, are you anything big on the agenda?
We're gonna head down. I think we'll be in Red Lodge for part of the day, and we'll be up here. And so it'll be a busy day. Head back, meet with the petroleum folks over in Huntley this evening, and then.
So it's just cruising around and listening.
Cruising around, meeting with folks, listening, just like the folks do the radio station. You know?
Exactly.
That's right.
That's what we're here for. We just get, a little less appreciation. What do you hearing from people when you go out? I mean, what are the because here's the thing, like I'm seeing it, I think, from a normal American point of view, and every time I watch like one of these listening sessions, it sounds like there are other politicians talking to you guys, like they know so much about it that I'm sitting here from I don't know that much about it.
Well, I mean, I have folks tell me what's in the bill all the time, and
yeah, exactly.
We don't have a bill, so it's pretty tough to sell what's in a bill until we get a bill. That's part of it. So there is a lot of information out there that I would say is inaccurate that we need to do a better job communicating on, and what I'm hearing from folks is depends on where you're at in the spectrum. I hear from a lot of folks who can't afford to get sick. I hear a lot of folks that say stuff like, I don't have health care, I don't want health care, and so leave me alone. Hear from folks who, are frustrated with the system overall, and that it costs so doggone much money out of their paycheck to live, to live, I guess is the right word. So we're hearing from all different perspectives on it. Absolutely. It's healthcare affects everybody. Don't care how old you are, don't care how rich you are or how poor you are, it affects everybody.
That's definitely true there. What do you think, where are people getting this information? That if there's no bill there, like where does this all come from?
There's a lot of, there's some of it's in the media, some of it's on the internet, some of it is, people are sending out mailers and stuff that, quite frankly, aren't correct.
Like the illegal immigrants, that's one that comes up. Like people saying it's going to cover illegal immigrants.
It's not going to happen.
Okay.
Max's bill is, once it gets out, Max has assured me that when that bill comes out, it will not add to the national death panels. No. Are people going to be, as they have done forever, talk about living wills and that kind of stuff? Absolutely. I mean, that's the way it ought to be. But as far as determining whether somebody's going to live or die by a panel, is ridiculous.
Yeah. What about this is something I read yesterday too, that not read somewhere crazy, but just the fact of supply and demand. If we add 50 million Americans to the healthcare thing, where are we going to get those doctors and nurses?
Well, I think you got to remember that part of this is going to help people stay healthy if we have a good prevention program, and I really believe that. I mean, I think that you can deal with things like diabetes and high blood pressure and heart disease in ways that make sense. People have to be educated in that, and it costs a far less money, and the quality of life is a a lot better.
Excellent. Makes a lot more sense now after talking to you this morning.
Oh man!
Hey, send our well wishes to Mr. Reberg there. I know you.
Yeah, absolutely.
You speak to Representative Reberg.
He's a heck of a thing to have an accident.
Yeah,
accidents happen. That's why you need healthcare, right?
There you go.
Well, our prayers are with the representative and his family, and Senator Barkas and all those folks who were involved in that.
Yeah, it's a sad story there. So hopefully everybody's okay, and great talking to you, and have fun listening to the Montanans today.
Good visiting with you. Good to see you guys.
It's good seeing you.
You got a ripping studio here.
I know. I just want to let you know that since you're downstairs, open invitation. Anytime you're up here in the morning,
I'm just
going to
come up here to catch the view.
Yeah, you can do that too. We'll throw, ask you a question on the side, something.
Sounds good.
Thanks so much for joining us. U.S. Senator Jon Tester.
The Big J Show. Weekday mornings from 6 till 10 on Billings' #1 hit music station, Hot 101.9.